You know what changes? Everything. Times change. Technology changes. People change. Sometimes it seems overnight. You can resist it. You can adapt to it. But you can't ignore it. Our thinking is to lead it by changing the way we work, changing the way expectations are met, leading clients and the practice of law forward. You know what that changes? Everything.
Hi there, I'm Dawn Chafe. I am the co-owner and executive editor of Atlantic Business Magazine, and this is Take 5 with the Top 50. It's a series of video interviews with Atlantic Business Magazine's Top 50 CEO Award winners. Each episode, I'll ask one of our award winners just 5 questions in an effort to see if we can find out what makes them tick and why they're so successful. This episode, I'm joined by Charlene Brophy. Charlene is the president and CEO of Fonemed. Fonemed is an international telemedicine company based in St. John's, Newfoundland. Charlene, thank you so much for joining me. Let's dig right in.
We've been greatly impacted by this pandemic in both, we operate in both the US and Canada. So week 1, once the pandemic hit our shores, we had a 400% increase in call volume. So the demand for service within, almost overnight just increased to that point that we were all just struggling to catch up. Now, fortunately, this is the world we live in. We've worked remotely for years. On the US side, we haven't had people in contact centers for 15 years. So we were well experienced on how to do that. Our greatest challenge in reaching, in responding to the demand is how are we getting enough nurses on the phone to respond to the concerns of the general public, and am I at risk, and do I need to isolate, and how do I respond, and so on. So it was an all hands on deck approach for us. Within 7 days, we had hired 52 nurses. We had hired 26 intake staff, all within a week. Nobody slept much, I can tell you, for that week 1, but we had to, and we expedited the training process and so on, so we could get them on the phone, because my greatest concern is that there were people out there in our local community or in our US communities that had this virus and didn't know they had it or were spreading it and just needed to know, how do I get tested? What do I do with this? So we had to get on the phone with them, and we had to respond faster. I didn't have hours, days to respond to people's questions. So the team, I'm really proud of how they moved so quickly to be able to respond to this pandemic. And on top of all of that, in Newfoundland, we had contact centers in Corner Brook, Stephenville, and St. Anthony that housed all of our intake staff. So all of our nurses and intake staff were located in those locations. So while we were ramping up during those 7 days, we had to get everybody home, because we couldn't keep them in the contact centers, because we had to keep them safe as well. Of course, that was my main priority. So we begged and pleaded everyone we could beg and plead with to give us computers, to give us monitors and mice and so on, so that we could get everybody home. But it worked, and I can't tell you how we managed to pull it all together. It just worked, and we did it. And I've been the strongest voice for telemedicine for so many years, in trying to bring some of the lessons learned outside our borders from the US or through our Latin American or Caribbean operations into our Canadian operations for such a long period of time. And I continue to always be a strong voice for that, and what worked in a more cost-effective and efficient healthcare service delivery model. But the adoption that happened overnight, I couldn't have even dreamt of it. So what changed so quickly is, all of a sudden, especially the elderly population who were always, well, no, I have to go into my doctor's office. I got to be touched in order to get care and so on. Became worried and thought, I don't want to go into a doctor's office. I don't want to walk into a hospital or a clinic. And the adoption of that generation in particular, it has just been mind-boggling. And I don't think that will ever go back, because now that they've learned this can happen, and my mother, who's 86, is one of them, who, I had always said, Mom, we can get a doctor on the phone with you. You don't have to go in. Oh, no, I have to go in. A doctor's got to see me. Now she does not ever want to go into a doctor's office. It's, can you connect me with your nurse practitioner again? Because during the pandemic, in addition to the increased demand for services, we also ramped up and started a virtual care clinic staffed by nurse practitioners. So we've got 8 nurse practitioners now in Newfoundland available to answer general public questions and respond to prescription refill requests and diagnose and prescribe and so on that we never had before. So it's a new added value service that's available to the province that moved much faster than we had anticipated it moving, but it absolutely worked. So it's too bad it took a pandemic to bring some of those lessons learned home, but they're lessons that have been well learned now, and I don't think will ever go away. I guess the benefit for us in particular is that we're a technology and a people company. So even though we've got the tools, we've got the AI that we can use to be able to offer individuals the ability to chat with a nurse or a nurse practitioner or text or whatever the case may be. We've also got people behind those phones and those those text messages and so on. So at any point in time, if they choose to use that technology, to use the artificial intelligence and start off with a chatbot, and they're worried, or there's triggers. So if they respond, let's say we're triaging a patient using the the texting piece. If they respond to a certain indicator that that would determine they're potentially at risk for something much more serious, then right away they get a message to say, "One moment, I'm going to connect you with one of our nurses." And then that message, that connection goes directly through. If it's in Newfoundland, to one of our nurses here in Newfoundland. If it's in Seattle, Washington, it goes through to one of our nurses in Washington, and so on. So I think what's worked for us to keep us competitive in the market is we can go out and offer our technologies just like all the others can, but we also offer our people to back end the technology as well. And that's been strategically for us, so important over the last number of years as we really try to gain some market in the international market. And we've been very successful because of that, because not only do we come with the technology that's offering a more cost-effective virtual care experience, but it's also coming with the people and the know-how behind it and how to apply the technology so that when hands-on and a voice is needed, we're right there behind it to be able to provide it. As this was unfolding during the pandemic with the demand for service increasing, we were inundated with nurses who were coming forward to us saying, "You need help, we can help you," and so on. The regional health authorities were great partners for us here in the province because a lot of the clinics were closed, and they came forward with their staff to say, "Can our nurses help you? We're not seeing anybody in our clinics now. Can they be of help to you?" So we onboarded them on top of all of the new hiring we did, and they, trained them on our system and our clinical COVID protocols, and they were able to manage some of those calls for us as well. And on the U.S. side, we had much the same type of response. We had a lot of our large clients. We've got some very large hospital groups and health plans in the U.S., for example, and so on, who closed their clinic doors. And because they had nurses that were available that couldn't see patients in daycare clinics and so on, they said, "We have nurses. Can we help you manage our volume?" And we onboarded their nurses onto our platform as well to be able to manage their own internal volume and so on. So we're very lucky because we were able to pivot because we offered not only the service and not only the technology, but a combination of both. That we were able to go out and say, "We've got nurses who can help manage your volume, but we've got the technology that your own displaced nurses can use to manage your own volume internally as well." So it was a win-win situation for us. And in Newfoundland, we've been one of those companies that are lucky enough not to only have survived this past 12 months, but to have thrived. I felt that it was very important as an organization that we give that back to the staff that were working night and day to be able to manage this pandemic. So we increased our wages for our staff, our frontline staff, to make sure that they were on a good living wage, which is very important to me. And because of that, I can tell you we've had buy-in like never before from our team, who, once the call goes out, depending on what sort of a media announcement is going on at any given moment, there's so many, the call volume can peak within minutes, and they're always right there to respond. So I think they felt that we treated them fairly, and in return, they're more than treating us fairly as well. I definitely have problems saying no. There's no doubt about that. I gave up in trying to find a work-life balance a long, long time ago, and I learned many years ago to have work-life integration. And my kids will say they grew up in my office because that's where their homework was done, and so on at the end of the day. But I am very active, and I think because I've had some success, and the company has had so much success as an organization, I very much feel that I need and we need to give back to the communities, in which we thrive. And that's been really important to me. So I'm very active in several different volunteer groups that are really important to me. And that keeps me grounded in many ways, to be honest with you, because I really enjoy that work. I really enjoy getting out there and reaping the rewards of seeing the people that we are helping. So I've got a great sense of social responsibility when it comes to that piece. And I really believe in having a voice as well. I'm not one to stand behind and criticize decisions that may be made, but I want to have a voice to say there's another option. I'd like you to hear my voice. So I've been quick to have a voice with any of the decision makers or key players in the province or in the country or in the U.S. as well when I have an opportunity to have an audience, because I think that's how we're going to elicit change. Again, this change of healthcare provision was forced on us overnight, but all of a sudden it's good. It's not only okay, it's good, and people are enjoying it and embracing it and so on. So we need to take some of those lessons now going forward and think, well, how can we now offer a more effective and efficient healthcare system? So how can we contain our costs? If there's a way that we can do this distantly, how can we contain some of our costs now? And that before we need to bring some more facilities that no longer, we don't require any longer. So I think a lot of those lessons will carry us forward as we come out the other side of this pandemic. And we're all looking forward to this mass immunization. There's no doubt about it. But we've got a ways to go yet to get there. And we can't stop talking about some of the lessons that we've learned so far and so on. But I don't anticipate that going forward, life will ever return to the provision of healthcare will ever return to the same form it was before. And you know what? That was necessary, especially for a small province like Newfoundland that's challenged in the way we are. If we can find a more, efficient, cost-efficient healthcare service delivery option, we should be doing that.